Viewers, welcome to the Learners Nursing classes. So let us jump into mock test 3, which in continuation with last 25 plus 25 questions. See, the question number 1 is Bell's palsy is a disorder of. So last video by mistake I have mentioned cranial nerve 6, but it is not cranial nerve 6, it is cranial nerve 7. So the Bell's palsy is a disorder of cranial nerve 7. Also, we should know that the cranial nerve 4 is the trochlear nerve and cranial nerve 7 is the facial nerve. Cranial nerve 9 is glossopharyngeal and cranial nerve 10 is the vagus nerve. See, trochlear is related to cranial nerve 4. Trochlear is related to ear. Cranial nerve 7 is the facial nerve. So, it is related to the Bell's palsy, the facial palsy. And the cranial nerve 9 is related to glossopharyngeal. Glossopharyngeal word is used for the tongue and the pharynx. And the cranial nerve 10 is the vagus nerve. So, the answer here for the Bell's palsy is cranial nerve 7. The cardiac troponin level helps in the diagnosis of myocardial infarction, congestive heart failure, ventricular tachycardia, atrial fibrillation. See, all of these are the heart diseases, and cardiac troponin levels when we do, for example, I'll tell you, whenever we do the TROP-T. So what is TROP-T? Troponin T test, that is done in myocardial infarction. So we should remember that cardiac troponin level help us to diagnose myocardial infarction. The commonest form of dementia is Alzheimer's disease, Parkinson's disease, vascular dementia, and mixed dementia. So here the commonest form of the dementia is Alzheimer's disease. Pain and tenderness in the region of symphysis pubis is indicative of, see now, pain and tenderness in symphysis pubis is the indicative of, see यहाँ पे सारे fractures लिखे हुए हैं, तो pelvic fracture, spinal fracture, femur fracture, rib fracture. तो obviously the answer will be pelvic fracture. The condition directly related to bone marrow suppression is, see, to know the condition which is directly related to bone marrow suppression, what is the condition? So anemia, sickle cell anemia, aplastic anemia, megaloblastic anemia. See, whenever there is a bone marrow suppression, it will be aplastic anemia. To estimate the percentage of burns caused for an individual, a nurse should use rule of 9, measure the area, measure the extent of pain, measure the extent of the depth of the burns. The option is not mentioned. So here the answer will be use the rule of 9, and if you go to my channel and see the shorts, I have made the rule of 9 very simple and very easy with the diagram. The term for the process of RBC formation is called as apoptosis, hemodialysis, erythropoiesis, and hematopoiesis. See, it is known as erythropoiesis, which happens by the erythropoietic cells in the bone marrow. First aid measure for a person with chemical in the eye is wash eye thoroughly with water, put eye drop, rub the eye, bandage the eye. The answer is wash eye thoroughly with water. The part of eye that is similar to a film inside the camera is cornea, lens, retina, or conjunctiva. See, here the question is the part of eye that is similar to a film inside the camera. See, so where the image is forming, retina or retina. During ECT, current is passed for, see, electroconvulsive therapy. The current is passed for, the duration is asked, 5 to 10 seconds, 10 to 30 seconds, 0.3 to 0.7 second, or 1 to 3 second. See, the answer is 0.3 to 0.7 seconds. Behavior analysis is based upon the principle classical conditioning, operant conditioning, dream analysis, or cognitive behavior. See, the answer is cognitive behavior. Hysteria is a mood disorder, neurotic disorder, psychotic disorder, or a personality disorder. See, hysteria is a neurotic disorder. The flight of ideas is seen in mania, depression, mental retardation, compulsive disorders. Flight of ideas are always in mania. Hallucination is a disorder of perception or thought or consciousness or a behavior. See, hallucination is a disorder of perception. The most commonest drug used in the treatment of mania is BDZ, lithium, imipramine or Serenase. See here, BDZ is benzodiazepines. So the answer is lithium. Extreme agitation related to dementia is referred to as acute stress reaction, conversion reaction, catastrophic reaction or manic reaction. See, extreme agitation related to dementia is related to catastrophic reaction. Delusion is present in mania, delirium, depression or compulsive disorder. It happens in compulsive disorder. Alcohol dependence is indicated by blackout, early morning drinking, withdrawal symptoms or physical discomfort. Here the answer is withdrawal symptoms. Suicidal tendency is seen in OCD, that is obsessive compulsive disorder, depression, mania, anxiety disorder. The suicidal tendency is seen in depression. The basic difference between psychosis and neurosis is the clinical features, severity, insight, duration of illness. Here the answer is insight. ADHD is a childhood disorder also known as hyperkinetic disorder, hypokinetic disorder, hyperactivity disorder or hypoactivity disorder. See, the full form of ADHD is attention deficit hyperactivity disorder. The answer is hyperactivity disorder. Psychoanalysis was found by Aristotle, Hippocrates, S. Freud, I. Pavlov. See, the answer is S. Freud. He also gave the S. Freud theory of life. Pulse rate above the normal rate is called as tachypnea, hyperpyrexia, arrhythmia, tachycardia. This answer is very simple. The answer is tachycardia. Exchange of gases takes place in kidney, lungs, liver, heart. See, lungs. The chamber of the heart which receives oxygenated blood from the lungs is left atrium, right atrium, left ventricle, right ventricle. The chamber of the heart which receives oxygenated blood from the lung is the left atrium. It receives the oxygenated blood first from the lungs. Thank you viewers. Like, subscribe and share.